Governor Bush at that time to have an alternative to a managed care insured model. And he wanted providers to become owners in the public health and the total health of the individuals in their community. And there was a piece of legislation passed, and there was 4 provider service networks allowed by legislation. Governor Bush, at that time, recognizing that he probably had more takers than the 4 slots available, asked the Jackson Health System, South Broward Hospital District, and the Memorial Healthcare System, or South Broward Hospital District, come together and form one entity in 1999. And in the year 2000, we wrote 2 agreements. One was called an interlocal agreement, and one was really the operating agreement. And it was to create a limited liability partnership between the 3 parties. And from 2000 through 2011, the structure pretty much stayed the same. And in 2011, the legislature passed a bill which said that you no longer, as of July 1st of 2014, could actually provide care to the individuals in the Medicaid program unless you were at full risk, okay, in that scenario. So we applied, we got the 2 districts agreed in February of 14 to come together, actually in late 13, to come together with Jackson to bid on the area of Dade and Monroe and Broward counties. We did. Dade and Monroe are one district and Broward is another district. We did not win the right to provide Medicaid services in Dade and Monroe County. We only won the rights to provide Medicaid services in Broward County. So the 3 parties, Jackson, Broward, and Memorial, came to an agreement to get out of the original interlocal agreement and to create a new interlocal agreement between the 2 parties, Broward and Memorial, and to change the corporation from a limited liability partnership to an LLC, equally owned by the 2 parties, 50-50. There are 2 board members, the CEO of Broward Health and the CEO of Memorial Healthcare System are the 2 board members. And the manager is myself, appointed by the 2, and we have the authority in the operating agreements. There's authorities I have and don't have, okay? And then there's those that I consider being responsible that I should bring to you anyway, even though I might have the authority. I think that from a transparency or an accountability point of view, you need to see them. So in February of 2014, we got the nod from the current Agency for Healthcare Administration to build what we call the risk-based provider service network, as you know now as Community Care Plan. We changed, it's a South Florida Community Care Network doing business as Community Care Plan, just a little more friendly. And that was at full risk on July 1st. So myself and my executive vice president, Jessica, and 180 other individuals literally went out there to do exactly what we thought we needed to do to run a business, to create it and run it. We found an empty building, no ceiling tiles, no floor, and in a 90-day period of time, we turned that building into an operating office. So we're in the old, right across from American Express, in the old Rayco Milgo building, if you've been here long enough. And we have about 50,000 square feet right there, 39 to be honest with you. But the business model itself was fine. It was there to bid on the services for Medicaid, and then we also had another line of business, which is really the care for special needs children. Now, we did not have to go to full risk for care of special needs children, but we were asked by the Surgeon General back in 2014 if we would manage the overall health and welfare of special needs kids from Fort Pierce to Sarasota to Key West. And we did that. So that's really our second line of business. Our third line of business was always really to be a TPA or an ASO for any public nonprofit entity. That's the way the documents read. So we are the TPA. We were the TPA for Broward Health's employees, and we were the TPA for Memorial's employees, and we still are Memorial's employees TPA. And we have two small, one existing and one upcoming public entity TPA contracts. Once we opened, effectively, we really had the scenario of what were we going to focus on. And in a presentation, which I'll share with each of the board members, there's a larger presentation, just trying to set up some background here. We live on 6 principles: quality, customer service, community, people, finance, and growth. And each of those has an equal element or value to me as the CEO and to the corporation itself. As being an accountable guy, an accountant by trade, the strategic planning of CCP was essential, because by the time you won the first contract and you had 2 years experience, you'd be bidding on the next 5-year contract. So we set out very simply to be in the top decile for quality by year 3. So when compared to everybody else, we were in top decile, or 15% improvement per year. As it relates to member services, which is your enrollee, or your customers, which is your physicians, okay, and your members, we agreed the fact that we would be, again, in the top decile by 2018. As it relates to people, we would be fair. This corporation started as a merger of 80 employees from Broward and 80 employees from Memorial, put in the same room, and the administration, so the board members gave us 6 months to kind of lease those employees, and effectively January 1 of 2015, we created a corporation with employee benefit plans, with the compensation plans, with the policies and procedures, and everything we needed to do so that they are no longer on Memorial's payroll or on Broward's payroll. They're on CCP's. So then the goal was culture of one, to make sure that every person in that building felt like they belonged there, and this is what they wanted to do. So people are our largest investment, our largest asset in the case of CCP. In finance and efficiency, we were given a target of having a medical loss ratio of 92%, having an administrative cost of 7%, and a profit of 1. We exceeded all those, and we're sitting here 38 months in, but as of June, you had 36 months of activity, and we returned to you $34 million worth of funding, okay, or of equity. How's that? We turned your original $5 million investment. We gave you back $6,650,000 about a year ago, and the rest is still in the bank at CCP for growth purposes themselves. As it relates to the overall growth of CCP, like any other entity, whether it's big business or small business, you have to think through where you're going to go. And in October of 16, we set on a strategic planning process for CCP, which we're going to duplicate or in the next month and a half with your team here, to see where we're going to go, because you have to be 3 to 5 years ahead. I've been a strategic planner and a finance guy all my life, so I don't necessarily think of the day. I think of where I'm going to go, so where the puck's going to go. So from my perspective, we will go through the strategic planning process. As part of that process, the question came up as it relates to what were we going to do for this 5-year new contract coming up? Were we going to go for it or not go for it? Okay, were we going to be in Broward County only, or were we going to be the back office to any nonprofit public entity around the state? And initially we had some takers other than Jackson, 2 other takers who had interest in having the community care plan be the back office for their new plan in their communities. And those, as time went on, we negotiated through and 2 of them dropped off, and Jackson Health System stayed in. So Jackson has been a good partner for us in the past, gives us a regional presence, and I was authorized as the manager to initiate discussions to get to some terms so that you could get to here. But I was not authorized to execute any documents, and I'm not here to ask you to vote on the documents because A, you need to see them. 2, there's still some input yet to be given on business terms, and 3, they have to be subject to legal compliance. Now, the 2 documents you're gonna see over time here is one is a consulting agreement, and one is an administrative services agreement. The consulting agreement gets you from today till January 1 of 2019, and basically gives Jackson rewards CCP $1.5 million for helping them put together their plan, the development plan. And then from January 1 of 2019, or January 1, 2019, there will be a 5-year contract with some terminations, which we'll talk about. The 5-year contract would be for us being the back office or the ASO or the TPA at no risk to CCP for the medical loss ratio for their contract. So what's that really mean? It says that on November 1st of this year, which is all too close, CCP will be bidding for its own business. It's a renewal of its own 5-year contract. And that's never been a question as it relates to the authorities and the desire to do that. The question is whether or not CCP or Broward Health and Memorial would support really the expansion into being a back office for Jackson Health Systems. In approximately a year ago, the Memorial Healthcare System said yes, okay, and gave to Mr. Fernandez, who's Bev's peer, the right to vote at a member meeting to go and proceed, to tell the manager to proceed and close negotiations subject to legal review and compliance review. So that's the way it's set out. So that's where we are. Today, that's the overview, and I probably talked a little too long and maybe duplicated some of these slides, but this is what's presented to you today is the consulting agreement, okay? And the consulting agreement, and then there's an administrative agreement, and then there's the pros and cons. Commissioner Wellen, you asked many good questions. Your first meeting here, you asked a few questions to me as it relates to the deal itself. So I break everything down into a SWOT, okay, or pros and cons. So in laying out this deal for CCP in the future, there's truly a benefit to the districts. There is a profit in the $500,000, and there is a profit in the administrative service fees agreement, and we'll show you how much that is later. So why, you asked the question, why would we do this? Well, we're going to do our regular thing, Medicaid and special needs and things like that. But this question here was to the financial benefit of the residents of Broward County. Okay? Can I say yes? And my answer to that question was yes to myself. The second question was, well, the second was really the diversification of revenues. Like any other company, you better figure out how to diversify in case you lose one pillar of the stool itself. And to maximize the economies of scale, you have invested a lot of money. We have invested a lot of time in the development of CCP. It is world class. I mean, it's as good as it gets, okay? But it can get better, okay? But what it would cost us to do for ourselves, the next one in is just incremental costs. And there are some true economies inside that. And really, as it relates to the provider networks and the member access, there's two questions there. One is the provider access. So what happens when a Broward County member chooses to go to a doctor in Dade County? Today, he would not be in network, okay? In the future, he might be, okay? And he might be under contract. So if we had somebody who was out of network in emergency in Doral, and they went to a hospital, the physician would be under contract. Hospital might not be, okay? Probably won't be. But from a point of view of access to satisfy the member himself, getting more providers, a stronger provider panel is a good thing. As it relates to the future regional opportunities, Jackson Health System in conversations has 3 priorities long term. Well, has a lot of priorities, but as it relates to here, they've noted 3. One is to get into the Medicaid business. 2 is really to get their employees into a health plan, okay? And 3, they have an uninsured program that is somewhat unmanaged right now. And they want to basically try to do what we do in our primary care systems, Broward and Memorial, and how CC supports those for them. So their goal is the trifecta. It's not necessarily limited to just the Medicaid book of business. And that would give us a regional presence. Now, why is a regional presence important? If you want to get into the business of doing Broward County government employees or school board employees over time, which is the goal of most of the public entities here, maybe not Broward's or Memorial's, but most of the entities have always said that they wanted to have a direct contract with the 2 districts. Without a back office, you can't do it. That's CCP. Without regionalization for the people who live in Dade, but work in Broward, okay, or work in Dade and live in Broward, you can't match all the access issues up as it relates to the members themselves. So being regional is another way of diversifying your opportunities to generate more business. What's the cons? There's 2 types of cons, 2 types in this Medicaid contract, 2 types of liquidated damages or fines or sanctions, if you want to call it. Some are process oriented. If I don't send you the file on day 12, I can get a $1,000 fine. Those are completely in control by CCP, okay? No big deal. The second kind of fine is a quality fine. Unlike commercial accounts, you either meet benchmarks or you pay fines for quality or lack thereof. And CCP is a vehicle that will give Jackson a tool to do that, and then Jackson will have to do it. So 75% of those fines will be the burden of Jackson Health System, and 25% of the burden of those fines is mine, limited to my administrative fees. Okay, so I am taking a little bit of risk, but it's an administrative risk. It's not a medical loss ratio risk. The operations of CCP, I won't kid you, it'll be a stretch for a while, and we'll make it happen. But we've stretched further than this. And the competition's reaction, what do the other plans think about you being in the business of Medicaid? Well, we've been competing with Humana, Better, and Sunshine for the last 3 years, and I personally believe that, they're actually all friends, and we compete very well, and I think it generates a higher level of competition when you get into it. And staffing challenges. We're going to have to go out and find some people, but that's okay. The timeline is really the authorization in September. Basically, the consulting agreement, as I said before, we go from when it's signed till April of 2018. There's a second phase of that consulting agreement. We don't know enough until the award is given or not given. You don't know whether you have to do something or not do something. So the second part of the consulting agreement is we'll sit at the table, and it's a cost plus model. So whatever we define the cost to be, we'll make our margin on top of that, and then we'll execute it all the way through to January 1 of 19. And then it kicks into the administrative service agreement. So the consulting agreement controls the first 3 boxes, and the administrative service agreement controls the bottom box. How we structure, how does this work? On the left is Broward Health, and the right is Memorial. I'm kind of in the middle. These are our level of executives, similar to what you would have in Broward Health. And then Broward will have a contract manager, which will be teamed up with a Jackson Health System contract manager. And that contract manager, for purposes of economies and efficiencies and timing, actually will be stationed at CCP. So the communications are office to office versus telephone to telephone. But it's easy to do. Location, all the back office services will be actually provided in Broward County. The contract manager, in this case it'd be Joe Rogers, who many of us know, would be the contract manager that stays in Dade. The account manager would come here, as I said, to CCP offices, and really we would be serving the geographical area of Broward, Miami-Dade, and Monroe counties. Now, if you think that's a stretch, for our other book of business, CMS, special needs kids, because Medicaid is predominantly kids, it's 88% kids, we're already the provider network from Sarasota to Key West to Fort Pierce. So we're basically, we have a structure there, and we can basically go further from there. It's not like we're starting anew. The estimated financial impact, the question comes is the amount of monies we offered to receive for the consulting agreement and the ASA, the Administrative Service Agreement, is fair. We had 2 independent valuations of this by a company out of Texas who does all kinds of valuation work. So we asked them for a low and a high range as it relates to the $500,000 and as it relates to the administrative services fee. You can see in this case here that they concluded that both fees, the $500,000 and the PM were within the relevant range of things, and there would not be any compliance issues or an enormous issue. Our request is really that the Broward Health representative, which would be in Bev, at CCP take all the necessary actions to finalize agreements between SF, CCN, and Miami-Dade Public Health Trust relating to the Medicaid managed care procurement in Region 11. And the second motion would really wind up being to direct Broward Health Council to finalize the review of agreements for compliance with the corporate integrity agreement. So we're trying to keep the business side and the legal side as 2 separate tracks to basically close in. I'm done, I think, and I'm on questions.
Any questions? Commissioner Lund?
I think my questions are still the same. The long-term administrative service agreement, I'd like to see how that works and how tied in we have. What's the control of that long-term, because that's the gravy. The meatloaf is good, but the gravy is where you're going to get paid.
Exactly.
And to the extent that we're going to invest a significant amount of time, resources, and people, potentially take the risk that we're taking, to the reputational risk, the penalty risk, the things that could happen if we expand beyond our ability, concerns me. I'm not saying I'm opposed to it. I'm not saying I'm for it. I'm just saying I'm still a little unsure about the administrative agreement and how that protects us. I guess that would come in the negotiation and what terms are there. Because if we're, if we can lock Jackson Health up to that for a long period of time where there's a penalty to come out early, or at least we recoup some of the benefits of it, I think I'd feel a little more comfortable. And I think that's what I asked and mentioned to you last time. I know it's hard.
I can tell you where I'm at right now.
Okay.
I went in with a 5-year no-cut contract. Part of the discussions, not negotiations, but part of the discussions, there's a lot of good faith between the 3 systems. And the way it reads today is that after 1 year and with 6 months notice, okay, they can terminate without cause. There's the typical termination with cause of breaches, stuff like that.
Correct.
But in reality, it's from January 1 of 19 through December 31st of 19. After that, they can give you 6 months notice. So you have a 1.5-year contract, effectively, if you the way you and I think, or you have a 5-year contract. I think them them abandoning the product, the penalties from the state would be so much that they would never do that. Now, if I'm not doing a good job, I'd give them a reason to terminate me, okay? But that's my responsibility, not theirs.
Okay, so what is the, so theoretically there could be an exit fee. I would imagine you could negotiate an exit fee if they decide to terminate. 6 months notice, I don't know. There's something to talk about. You mentioned something today that I didn't hear last time, and is the ability to compete for Broward and Dade County public service healthcare. What's that business plan look like, and what do you think that business is worth?
Within the last month, we got approval from Broward County government to actually be, we're negotiating later this week, to be one of the offerings for the Broward County employees. Okay, they have their plan set, so we would just be the back office being paid an administrative fee. And effectively, it's a narrow network. It would include Broward, Memorial, Holy Cross, and Cleveland Clinic only. Okay, so it would effectively be a non-for-profit network being offered to county employees. The county has always wanted that. The school boards have always wanted a public option, if you want to call it that. You know, a local public option, not the national public option. But these are services we provide today from 25,000 covered lives at Memorial and our own employees. Okay, so it's not like it's a new service. It's just basically an expansion of the number of members covered under administrative service or TPA agreement. And we are a licensed TPA.
So we would get a per person that shows.
You get a PM per member per month administrator fee. You wouldn't be at risk for the medical loss ratio just for the cost of administration of the program, much like United or Cigna or anybody else does.
Would they have to select us, or is this something we would provide on behalf of the county to all of their employees, but they choose the plan that they want?
That's that's up to the entity on their side. In this case here, we'd be one of 3 plans, okay? In some cases, you might be just a direct plan, like we are to Broward Regional Health Planning Council. We're the only plan to them, okay? As it relates to some of the cities, they might want to have a PPO option and a narrow network option. We can always be this. We can buy, okay? We could do a wraparound and make it happen. But, you know, the question is, was CCP designed to really be in the business of insuring people? No. Okay. Was CCP designed to support population health or a TPA or an ASO business? Absolutely yes. Okay. Because you can't take the risk for the employees of Broward County. You wouldn't want to do that. Okay. We did it for Medicaid. We don't do it for special needs kids. You don't do it for Memorial. You don't do it for Broward Regional. You are just the back office. Okay.
Now, does adding Jackson into the mix, how does that strengthen our offering in that part of the business? Or does it?
It does, because it adds to the network. As being Jackson in the mix, Jackson will become a provider in Dade. So that, let's say you have a referral for a special needs kid or a case where we can't handle it in Broward, okay, you have Jackson as your backup. They are your other safety net with the University of Miami, but could supply a service that we might not otherwise have. Second thing is, if in essence they were in the network, that means we probably have a contracted rate that's better than the street rate, okay? And therefore they become part of the play. There's a lot of synergy between the 2 parties here, 3 parties in total, but you know, we have to get to that point. It is part of the dream, okay? Now, the question is that what the owners, yourself and South District want? And the strategic planning process was 6 to 9 months, where we went through all these options, and like we made a choice not to be in the Medicare business. Okay, and it's too competitive. You know, it's not for us. Okay, did you want to be in the exchange business? Too competitive, not for you. You know, do you want to be in the back office of supporting indigent care or Medicaid? Okay, the answer was yes. So we've stayed in what I would call the product that's done, public employee or somebody below the 400% of the federal poverty guideline. That's kind of like our niche.
Okay. And the last question, and I don't want to manipulate all the time, like it's fair to the other commissioners. You mentioned Broward. Have you had any of those discussions with Dade County about their potential employees being a TPA, or they have?
Jackson is Dade County.
That's the only option for them?
You go through Jackson, you get the county. Carlos Magoya would tell you the fact that that's one of his dreams, was always to get Miami-Dade County employees, ASO or third-party administrative program, because he has about 25%, Miami-Dade County has about 25% employees live in Broward. And they really have no relationships other than through another HMO or conduit. Okay? They don't have a one-on-one relationship between the public to public.
Okay. I've got no other questions right now.
Mr. Chairman, so first of all, thank you very much. That
Thanks,
was
Beth.
a great great presentation, and I understand the time restraints. I'm wondering though, what I'd like to do is we have the new operating team here. I'd like for them to review with our legal and compliance what your motion 2 was, and that get back and then make a recommendation, if I may say to the board. We'll come back with a recommendation for you all, and then we can move on. Is that acceptable?
Alan has, supplied, Deb has in her book, he asked for a 2 to 3 page business case to be written up, and I have that, and we'll share it with all you so you can get the short story. Okay, but if you want the long story, we invite everybody to come out, kick the tires. It's a public entity. Anybody can walk in anytime. Okay, so I'm you.
You know, John, the difference is Jackson is metro, they have a different system.
Correct.
We do, we're chartered. So, but we're all in the health business, you know, so.
You know, Chairman Rodriguez points out the fact that, public health service is part of the Dade County, part and parcel. Okay, I think Lynn knows more about than probably I could share with you, but they walk in a good relationship. They really have a good relationship between the success story at Jackson recently and the Public Health Trust. And I think that CEO McGoya has done a great job at recovering Jackson, okay, over the last 5 years. And 5 years ago, he got out of this business on purpose, okay? And now he wants to get in this business on purpose because he cares for most of the high-end Medicaid patients, and he wants to keep them for business purposes. Now, only about 2% of your Medicaid patients actually leave Broward County, okay, for services. So, and they typically, 1/4 or 1% go somewhere in the world, and the other 1.75% go to Dade.
Okay, so we're all settled. Thank you.
Thank you. Thank you, everybody.
Yeah, thank you. Okay, this adjourns the presentation and the workshop. And we,
5-minute break. Just go.
you want a 5-minute break?
Oh, no, we're good. Okay, because it's, what time is it?
4:15.
Oh, no, go.